Let's go to Southampton in the United Kingdom and speak to Ben McCluskey, who's a coronavirus data analyst. Ben, welcome to the programme. First, tell us what your numbers show about the effectiveness of travel bans in terms of the spread of the virus.
Well, it's certainly the case that countries around the world are responding to Omicron. They're very concerned. Will they work? That's a question that many of us have been wondering for a while. In the short term, yes, they do, but only to some degree. We've seen significant community transmission, and that's the reason why the red list was only recently abolished in the UK, because a significant level of community transmission meant that it had no purpose.
What do we know about the different strains in terms of the sequencing that is being done in the UK? Because 1,600 odd of these 88,000 cases in the past 24 hours are confirmed to be Omicron. Many people think that actually it's probably a lot higher.
For sure, yes, it's certainly a lot higher. There's only so much sequencing we can do, and it is going to be the case that Omicron will become the dominant variant in the UK. I think Nicola Sturgeon has said today that by Friday it will be the case that Omicron is dominant in Scotland. It's already almost dominant in London, and we're going to see that across the rest of the UK. Jenny Harris, who's the head of the United Kingdom's Health Security Agency, said only yesterday that there's a doubling rate of around 1.9 in most regions across the UK. So it's an ever-changing situation. Countries are very concerned because there's only so much we know about Omicron right now and its severity in comparison to the Delta variant.
And what would your analysis be of the coronavirus, whatever strain we're talking about, around the rest of the world? Because there are great concerns that some countries just don't have the ability to test and that the numbers could well be far, far higher. It was a few months ago that the World Health Organization said we're probably looking at numbers that are at least 3 times higher than are being reported. We, for example, at TRT World, like lots of other media organizations, we use the Johns Hopkins University coronavirus tracker. So what do you think of the real numbers compared to what the media around the world are reporting?
Well, it's all in the positivity rate in the sequencing. So in the UK, for instance, we do a very, very high number of testing. We have PCR tests, of course, and the lateral flows that you're seeing everywhere right now that people are doing their best to get hold of. And we're seeing a positivity rate around 6%, 7%, 8% even in some cases. But compare that to South Africa only a few weeks ago, we saw a positivity rate of around 30%. So cases are far higher than the confirmed amount, and that's the case everywhere. In France, I believe the positivity rate is hovering anywhere between 7 and 10%, and that's different across many European countries dependent on their testing capacity.
OK, now this is a really delicate question. I mean, you could make it international if you want, but if we take the UK as an example, what evidence is there, again, when you look at the data and the hard figures of the government following the data? I mean, we probably feel that some countries have followed the science and the data better than others. What is the UK's record on that? When you look at the numbers and you look at the political developments and the restrictions and all of the decisions being made about protecting the public?
Well, I think you've only got to look at the 4 nations in the UK. There's such a different approach across England, Scotland, Wales, Northern Ireland. Nicola Sturgeon only the other day said that was advising against the mixing of households, only mixing where necessary, because we don't know much about Omicron. That was her justification. We're not really seeing much of that in England. We're seeing it from the chief medical officers, Chris Whitty, and the likes of those, but not necessarily from Boris directly. So there's a very different policy amongst the 4 nations, and I think we're going to see more developments there.
Ben, thank you so much indeed. Really appreciate it. Ben McCluskey, coronavirus data analyst in Southampton.